Autism spectrum disorder, or ASD, is a disorder encompassing a wide range of lifelong conditions. Because it is a spectrum disorder, the signs and symptoms can vary, giving each individual a unique set of challenges and abilities. The characteristics and prominent features of ASD are deficits in communication and social skills, repetitive, patterned, and unproductive behaviors, interests, or activities, as well as emotional and behavioral difficulties. The DSM-5 breaks down the social, emotional, and behavioral criteria into specific signs. Additional criteria to receive a diagnosis include symptoms must be present in early development but may not become fully apparent until the social demands exceed limited capacities. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning, and the signs and symptoms are not better explained by an intellectual or developmental disability. Autism may be comorbid with ADHD, anxiety, schizophrenia, and mood disorders. Because roughly 30 to 40% of children with ASD also have ADHD, and a third have an intellectual disability, diagnosis can be difficult and delayed. Diagnosis typically occurs very early in childhood, sometimes as early as 15 to 24 months, but may not happen until school age when deficits truly become apparent. Early intervention improves outcome, learning, communication, and social skills. Occupational therapy practitioners provide direct services, consult and collaborate with people close to the client, including family, educators, employers, and other members of the healthcare team, as well as advocate for community support and inclusion through modifications and accommodations. The holistic approach that occupational therapy provides is an excellent match for the varying degrees and challenges people with autism experience. Occupational therapy can focus on mental and cognitive challenges through early screening, standardized evaluations and assessments, and by providing support and services that promote engagement and cognitive development. Additionally, the client-centered practice of occupational therapy ensures that each client is seen as an individual first, with challenges that can be addressed through thoughtful assessment of the client's performance skills, patterns, the context of their environments, and their personal goals. Interventions guided by evidence-based practice can address some of the following areas: sensory integration and sensory-based strategies, social emotional development and self-regulation strategies and programs, cognitive behavioral approaches, especially in collaboration with team members that support positive behaviors, social participation in activities, motor development, positive mental health strategies, peer group and peer-mediated strategies, visual supports such as schedules, timers, and video modeling, technology recommendations in education and work activities, approaches and strategies to promote transition to adulthood, independent living skills, training and modifications, strategies to support personal responsibility of self-advocacy skills, and work readiness skill development. Because autism spectrum disorder is a lifelong condition, clients all across the spectrum at a variety of ages can benefit from occupational therapy services.